and good morning, dear viewers. You're most welcome to the DAKTARI show, and this is a health educative show which airs here on West Nile TV every Thursday from 10 a.m. to 11 a.m. where we bring you people in the medical field who are expertised to come and educate you matters regarding your health. Today with us we are going to tackle another interesting topic regarding your eye. Many people often you are ignorant about matters regarding your eyes. Today we have a doctor, an ophthalmologist, who is going to take us through blindness. Many people could be there in the community, you don't know the causes of this blindness, so he will take us through which things you could be doing which could put you at a risk of getting blindness. You're most welcome to the DAKTARI show. Dr. Amos, you can introduce yourself to the viewers.
Thank you. I am Nyatirombo Amos. I'm a medical doctor, specialist in eye care, what to call ophthalmologist. I'm a lecturer and head of department of ophthalmology at Kulu University. I'm also a medical director of Pibero Medical and Eye Care Center, Narua. You're welcome, viewers.
All right. Thank you very much, Doctor. Indeed, we are grateful you giving in your time. We know you are a busy man, so we don't take it for granted. So let's speak on our today's topic, blindness. Many viewers may be there in the community, just they hear the word blindness. Blindness, what could be blindness?
When we talk about blindness, we mean inability of somebody to see objects clearly, or when a person does not see objects, even those which are close to him or her. Technically, someone is blind when he cannot count fingers placed to the eye at a distance of 3 meters. If someone puts his or her fingers 3 meters away from your eye and that eye cannot see that finger, then it means you are blind. But many people think if you're blind, you are not able to see anything. It's just like all darkness. Once you cannot see fingers raised at 3 meters away from you, you are blind. It means you can't perform your routine duties. Yes.
All right. Thank you very much, Doctor. So, a viewer may be asking, you are telling us like it's an inability, maybe even to see my eyes, not only just seeing darkness. Are there things people in the community, which things they could do to put them at a risk of getting this blindness?
Even before talking the risks, we should know what things cause you to become blind.
Yes.
We have blinding conditions. And in the developing world, in Africa, like in Uganda or in West Nile, 80% of blinding conditions are reversible or preventable.
Yeah.
It's only 20 or 10% where someone becomes blind and we have nothing to do. We cannot prevent the person from becoming blind, or we cannot do anything to reverse the blindness. So, blindness could have been one of the easiest things to prevent or control. Commonest causes of blindness are, the one is cataract. The commonest, 50%,
Yeah.
to 60%.
Sorry to cut you short. If you are asking cataract.
Yes, I'm coming to that. A cataract, you know, in the eye we have natural lens. Unfortunately, I left the module of my eye, but I have a simple drawing here. The natural in the eye we have, can help me have this. This is the eye. Then the light comes from you through the eye onto the back of the eye, something like a film of a camera. Is this lens which will focus the objects, the image, the light from the objects onto the retina, which is the film of the eye. So this eye, this lens, once it becomes opaque, light cannot pass through it. So the light remains here, is blocked.
Yeah, so the person may not be able to
see. Will not be able to see. And the commonest cause is age. Once you reach 40 years, the lens becomes aged, it may become opaque. It's not clear, it loses its clarity. And the person starts seeing blurring, cloudy vision. In Alur, we call it Sheru. The Acholis, they call it Kele, and so on. So once that cataract comes in, due to age, at times even a trauma, when someone boxes the eye, knocks the eye, or hit the eye, or injures the eye, you can also develop that cheru or cataract. The second one is what we call glaucoma, second common cause. Cataract can be prevented. Blindness due to cataract can be prevented by simply doing operation. This morning I have just been operating on a patient who was blind. Both eyes cannot see, cannot even see the fingers, can only see light. And the operation takes only 10 minutes. And after you plaster the eye for 1 day, and after the following morning you open, the person is seeing
very well and clear.
Very well and clear. They threw away their sticks and even leave the attendants who have brought them, walking back home. Then glaucoma is the second cause of blindness. Glaucoma is a raised pressure inside the eye. You know, we have blood pressure. The eye also has eye pressure. That's why it's round.
Yeah.
The reason why it's round, we have some fluid inside the eye. If someone pricks your eye, the fluid, the water comes out and say, this eye is now spoiled.
Yeah.
When that water is inside the eye, the water is also produced by the eye, should come out of the eye and go back into blood. So the rate at which it's being produced should be the same as the rate at which it's going into blood. So if there's anything which stops that smooth flow, that equilibrium, then the pressure inside the eye starts rising and rising and rising. And it goes and kills the nerve, the optic nerve, that nerve which relays the image formed to the brain, so that the brain interprets it as being you or as being him, and brings it back to the eye. So that nerve is damaged due to the high pressure. And this one can also be controlled by either drugs or by surgery, by operation. Even this morning we did operation in one person. He came here in August. He was seeing with both eyes very well, but blurring a bit. So I told him, you man, take this drug. After 1 month you come, we start doing operation, one in one eye, then in the other eye. He didn't come. The next time he came in April. Yeah. One eye had already gone.
Actually, that's a concern, doctor. You know, when you treat the people and they get a bit better, they always don't come back for treatment.
So he came last week, one eye had gone, even the other one which was seeing now was going. I said, sir, you are not going back. You have to do this operation in the remaining eye so that we help it. Yeah. And we did the operation this morning. Now the problem with these two diseases, cataract and glaucoma, or the rise in pressure in the eye, they cause blindness without you knowing. They are not painful. They don't pain you, but they come gradually. And you keep on adapting. For you think it's normal. Till when it's now late, that you realize, oh, now I cannot see. So we have glaucoma. The third one, we have things which can injure the cornea, this black part of the eye, the glass of the eye. Can be bacteria, can be herbs. You know, we do a lot of herbal medicine or practice.
Yeah.
So when they injure the eye, things like trachoma, red eyes, which are not treated very well, can cause scarring, and they also cause blindness. Then diabetes.
Yeah.
Diabetes is a silent killer and a silent causer of blindness. It also does not cause blindness. It does not cause pain. You have painless loss of blindness. You have abnormal vessels forming in the eye. It can cause high pressure in the eye. You have the film or the retina start swelling, can cause cataract. So, but it doesn't pain. You have high blood sugar. Then you have distortions of the working of the eye.
Yeah, because
so this can also be prevented. Eat healthy, control your diabetes, measure your blood sugar. Every year, everybody should have general medical checkup, including taking your blood sugar. Every year, everybody, whether they're healthy or not, should have general eye checkup, so that for the first time we find out you have high blood sugar or diabetes when we look into your eyes and see, oh, these are signs of that.
Yeah.
Then we have what we call the refractive error, like short-sightedness and long-sightedness. People say, me, I'm short-sighted. Oh, I'm long-sighted.
Yeah.
So what is that? It means images of distant objects which are very far. The images either they are not formed on the retina, so they look blurred. They either formed inside the eye or behind the eyeball.
Yeah.
So you see it's cloudy. So it means you must move nearer to that thing
To see it very well.
to see it very well. Huh? Yes. Or you take, if you're long-sighted, you have to take it further. Huh?
Yeah.
See, if it's long-sighted, distant objects are formed behind. So you have to move that object further away from you for you to see. If you are short-sighted, objects form
Before.
yes. So it means you have to bring them nearer.
Clear.
But you can prevent the loss of vision or loss of sight by this refractive short-sightedness or long-sightedness by using spectacles like mine.
Yeah.
At times when you're aging, you can't read. Like me, I'm not short-sighted, I'm not long-sighted.
Yeah.
But because now I'm above 40 years, I'm about 50 something, I cannot read near things. I have to be taking it away. Because the lens in my eye cannot change its shape to focus. So I now get spectacles, I put it and read. I've seen people suffering in church. They are singing, but now they are singing.
They put it very far.
They have to put it very far. Now they are pressing, they are pushing away the back of the head. And this person, instead of paying attention to the preacher, has to turn around. Who is touching the back of my head? But if you wear appropriate reading glass, the eye, see, everything is normal. Now I can read. For you, you are a young man, you can read this without glass.
Yeah.
Me, I can't read. So, very simple. Reading glasses are not expensive. Yes. Then in children, we have, some people are born with abnormalities. And they are blind. Then we have conditions which don't cause blindness, but primarily they don't cause blindness. But if they are mismanaged, they can cause blindness.
Yes.
Like what we have now, the red eye now.
Actually, it is prevalent.
Yes. It is an epidemic. It is a viral infection. It's a virus which is affecting us. And we all know viruses don't have treatment.
Yeah.
That's why HIV has stayed with us for very long. Viruses don't have cures. Very few have cures.
Yeah.
Even this one, which is causing us red eyes, it's a virus. It has no treatment. The only thing is wash your eyes with clean, cold or warm water frequently. It will go by itself after 1 week, 5-7 days. It will go by itself. Don't start applying drugs. What is making us suffer more? Now we run to clinics, go to pharmacies, we buy eye drops. Dexamethasone, betamethasone. When you put the eyes swell, and it's causing atrophy. Some people now after 2 or 3 days, they go and start using traditional medicine, herbs. Some people even putting urine. I got a child here from Yumbe some 3 weeks ago, had simple red eyes, applied herbs in the eye, possibly urine as well. Then he introduced germs, bacteria into the eye.
So it worsened the condition.
Worsened, the eye became swollen, became very red, started discharging pus, the eye perforated. So he's just a candidate of removing the eye. Yet this thing could have been cured by simply washing the eyes with the clean, cold water, which we have.
So doctor, do you think of red eyes which is worrying people? Just washing the eyes.
When you get red eyes, don't panic. Don't panic. Just wash your eyes with clean water. Don't add salt in it. Don't add tea leaves in it. You drink your tea leaves in your tea. Take your salt in your soup. but use plain water and wash your eyes frequently. Then you can come to us. Then we advise you. If you need some drugs, then we can say, okay, this one needs this kind of drugs.
Yeah.
The eye drops are very dangerous. There are over 100 types of eye drops. Some of them, when you put, like this one, like this one, this one, if I put it on your eye, you will get instant relief.
Yeah.
It's an anesthetic. You will not get any pain in your eye. Now, if I gave this to you and you went with it at home, because you are not now getting pain, yet God created pain to make you aware that there's a problem with your eye. Now, for you, there's no pain.
But you're continuously
anything, the eye is sick, but you're not getting pain. So any injuries you even don't know. So it's very dangerous to your eye. Even if I prick your eye, you will not know. This drug is very dangerous.
Yes.
There's another one here. This one, you can see it's red. We use it for treating certain diseases. We use it to treating certain diseases. Like if you have red eyes, we can put it. But if I put it, one drop alone will make you not read your books for 3 weeks.
Why? It makes it clouded?
It paralyzes the muscle inside the eye, so the lens cannot model itself. So you will not read your books for 3 weeks. Now, if you are a student and you are going to sit exams, then you have put this drop because one time it was used for treating somebody. You will not read your books, you will not research, you will not do exams. There are so many drugs. This one has 2 drops. One is to prevent reddening of the eyes. One is to kill the germs. One of the drugs is to kill the germs. One is to prevent redness. But the one which prevents redness, the steroid, can cause germs to multiply in your eyes. Now, if you pick this and put it, especially viruses, like if you put this in a red eye, it's like you have put urine or herbs in your eye. Yet this is a modern medicine. So people should not simply go out and get drugs. So we do what we should give to patients. If you have to put drugs, go to an eye care specialist, like this one. Then they say either drugs or no drugs.
Okay. All right. Thank you very much, Doctor. So are there other causes apart from those ones you have discussed?
Yes. There are others which come due to old age. Like I usually tell people, once you reach 40, God will give you a companion, which is a disease, to live with you till you leave the world. Just as you age, I call the spectacles your walking stick. The walking stick is
a companion.
Yes. Like for me, I don't even think failure to read is a disease. Because I'm aging, I now need the walking stick of my eyes, and I read normally. So when you age, the retina, that most sensitive part which picks the image, also ages. It undergoes degeneration. We can't prevent that. Whether we want it or not, like we cannot prevent aging. The cornea can also degenerate. This black part degenerates. So others like pressure, high blood pressure, but that one we can control. When your blood pressure is very high, it can also destroy the nerves in the eye. There are others who develop goiter. This one. It's a general disease. Swelling of this thyroid gland. It can also cause the eye to prop up, what we call proptosis. When the eyes prop out, they protrude out, the corneas become dry, and they cause wounds, corneal ulcers, and you can also go blind. Yes. Then injuries. I'm getting a lot of children, especially these days, with injuries. The eye is torn. Children are playing with the sharp objects. We cannot control these
in the eyes.
Yes. Yesterday, a child had the eye pierced by another child. The parent brought here. I said, "Can we have this child? We need to repair the eye." He said, "No, I've taken the matter to police." It's the parents of the other child to come and treat this child. I said, "But really, that's child abuse. That's being responsible." And the eye, once it's injured, should be repaired within 12 hours. Now it was injured the previous day. Now this mother, for the parents, for them, they want the police to go and arrest the parents of the other child, to force them to take the child for treatment. Really? And that child is going to lose the eye.
And yet you could have done an intervention very fast.
Exactly. Now they have gone home looking for police to help them. I'm appealing to the police. Such cases, tell them first go and get treatment.
Yeah.
The legal aspects will come later.
Yeah.
Yes. The legal aspects will come later. That's what we should do. Then the other conditions, measles. Measles happen because we are refusing to immunize
the children.
The government has a program of free immunization. People are saying, oh, now the government wants to kill us.
Yeah.
The government wants to kill our children. Me, I survived because of immunization. That's why I'm a doctor. Have my children, all of them have grown up, therefore, all of them vaccinated. One actually got measles, but he got a mild one.
Yeah.
Because he was vaccinated, immunized against measles. So measles can cause blindness because they cause injuries, wounds on the cornea, on the eye. The eye is dry, and they eventually become blind. That's why many children before these mass immunizations were going blind. Yes, even TB. Immunization against TB has helped us a lot. We have TB of the eyes, but they have gone away due to. Then we have river blindness. River blindness in West Nile. People's skin, very prevalent. People's skin like of crocodiles or leopards in West Nile. But the government with the World Health Organization gave drugs to everybody. What they used to call ashel kunus or 1.5. So with river blindness now not a problem here, but people who got the disease in the 1960s, 1970s, 1980s and 90s, when the drug was still not there, have the disease in the eye, because now it has killed the nerves and it's a permanent damage. But now the generation now from 2000 and forward, I think are now clean of river blindness. We only have river blindness in the Choli sub-region as a public health problem, but in West Nile now,
it is reducing.
It has reduced.
Yeah.
Yes.
Okay. All right. Thank you very much, Doctor. I hope our viewers are getting to note these causes of blindness. And the doctor has emphasized it be the measles. Please vaccinate your children when they are still young. Take them for these government programs. If you get the red eyes or the conjunctivitis, please be serious with it. Treat it. And the doctor has told us there's actually like red eyes doesn't require any treatment. Just frequent washing of your eyes with clean water. Yeah. So, doctor, are there maybe some risk factors or things people in the community could do which could put them at a risk of getting blind, except these causes?
Yes. In addition to what I told you, like cataract, whether you are what, you may get it.
Yeah.
If you are diabetic, you will get it.
Yes.
Glaucoma, we don't know why some people get it, some people don't get it. But there are basic things which we need to do to prevent us. One, good feeding, balanced diet.
Yeah.
I already told you, balanced diet is good. You feed and avoid diabetes. Diabetes is a risk factor.
Yes.
2, malnutrition. You have lack of vitamins. Most times when you come, we give you vitamins. Vitamin A is a magic drug. And we get it in greens. We get it in muziri, all these silverfish.
Yeah.
We get it in mangoes. Vitamin A deficiency is a common cause of blindness. Then that's our feeding habits.
Yes.
Then I've talked about immunization. Let's vaccinate and immunize our children. We will remove measles, we will remove vitamin A deficiency.
Yes.
Okay? Then hygiene. The people who don't wash their faces, the people who don't bathe, houses which are not ventilated, those are risk factors for red eyes.
Yes.
You're greeting I greet you, you go out every day, I will
Someone just touches
yes,
the
I
eyes
did. I've
even
touched the
without-
eye. I've not washed my eye. I've gone to the toilet or public place. I don't wash my house. I don't my hand. I don't sanitize. Then we have those are risk factors.
Yeah.
Overcrowding. I don't know what you can do about it.
Yes.
In our settings, in a house, you will regularly get
Even now, yeah, it's a city now.
yes, you get 10 people in a small room without ventilation, and those are risk factors for trachoma and other causes of discharges in the eyes. By the way, going for antenatal services is very important for preventing blindness in the newborn.
Yeah.
Because a mother who goes for antenatal, they will check the baby. If the mother has urinary tract infection, they will treat her. But if she's not, during childbirth, if she has urinary tract infection, the urinary infection will go to the eyes of the child
So
as the child
these
passes
germs,
through the childbirth
The germs go into the eyes.
into the eyes and cause blindness, cause discharge in the eyes. That's why children, mothers are encouraged to deliver in the hospitals or maternity centers, because from there the midwives take care of the eyes of the children immediately, and they're also given tetracycline eye drop for all children to put in the eyes to prevent infection. If that is not done, children develop red eyes, and discharges, and the eyes perforate. They become blind. Now, making a child to be blind up to adulthood for 70 years is a terrible thing. So antenatal services help us ophthalmologists to solve our problems.
Okay.
So mothers should attend antenatal, then they will not have to come to me, to my clinic, because the children have developed red eyes. Now, another disease, risk factors, now pollution. Our environments are polluted.
Dust
We are using
everywhere.
dust. We are using, especially the women, using cosmetics, all kinds of chemicals in the hair, on the face. People are bleaching red. Yet that dark skin color, God gave it for a purpose, to protect us against developing cancer of the skin.
Yeah.
We also develop cancer of the eyes due to this sunlight.
Yeah.
But the pigment inside our eyes, the black one, when you look at our eyes, they look black. For the whites, they look pink, even white. So that black one absorbs excessive light, sun rays,
Which
and
could be
protects
dangerous,
us.
yeah.
Yes. So when you bleach, you cause cancer, and we even have cancer of the eyes. And when there's cancer of the eyes caused by the sunshine, because you're exposed in sunlight, you have already bleached. You have the skin here, they are bleached. I even removed one from a Congolese, cancer of the eyelid last week.
Yeah.
So bleaching is a risk factor.
Yeah.
You develop cancer of the skin, cancer of the eyes. They also cause itching, allergy. These chemicals, cosmetics, from people remove the eyebrows. Even the eyelashes now, they replace with artificial eyelashes. These eyebrows help to collect dust.
Yeah.
The eyelashes collect sweat and dust. But when you remove them and put pencils here, pencils will not stop the dust. They will go straight in the eyes. They start itching.
Yeah.
What we call allergic conjunctivitis. Very common in women
Yes.
because of cosmetics.
All right. Thank you very much, Doctor. Indeed, it has been an exciting episode of this first segment, and our viewers have gotten to note of the things doctor has been telling us, which we could be doing in the communities, which put us at risk of getting these blindness. So maybe, doctor, let's first go for a short commercial break, then we shall come back in the next segment where doctor will take us through how can you present in case you have blindness, although it may be automatic, you'll be blind. Also, take us through when you go to the hospital, how do they always know maybe you are short-sighted or you are long-sighted, and also the other tests they do to confirm your blindness. Thank you very much. Let's get back at dear viewers.
West Nile TV, lighting up the region.
The search for Miss Uganda 2024 is on. Get ready to be wowed by the girls' intelligence, charisma, and big dreams. Who will be the next Miss Uganda? Find out starting 10th May every Friday to Sunday at 8 p.m. on Makulachika, exclusively on Star Times. The show is sponsored by LMZ, Comform, Nanjing Hotel, Kira Motors, Sheraton, Uganda Airlines, and lead sponsors, Grass Textiles and U-Home. Miss Uganda 2024, true Ugandan beauty.
West Nile TV, lighting up the region.
We'll be back, our dear viewers, from that short commercial break, and still the Daktari show here on West Nile TV, a health educative show which airs every Thursday from 10 a.m. to 11 a.m. And I'm always your host, Sunday Junior Tom. Today with us we have Dr. Amos, who is taking us through blindness. Often people in the community, you face these blindness problems or complications. You don't know the causes. Where in the first segment also took us through the causes of this blindness and things you could be doing which put you at risk of getting this blindness. So now in this next segment, doctor is going to take us through how do you present in case of blindness? How do they diagnose, or how do they know that or confirm you have blindness? And also, which complications can you get in case you are reluctant on managing any eye complication or blindness? Which complications you could develop? We'll be back from that short commercial break, doctor.
Yeah, thank you. Usually, patients come to us. Unfortunately, most blind people don't come. Like I told you, most of the blinding conditions are painless. In Africa, once something does not pain somebody, then the person does not come.
They want to know they complain.
Yes. Even if the person is not blind, but there is pain, the person will run to the units. Here we have our unit, Pibero Medical and Eye Care Center. It's actually the only center now in West Nile that is doing eye surgery in conjunction with the Life Care Hospital, that's former Family Care Hospital. Arua Regional Referral Hospital has a fully fledged eye department but doesn't have an ophthalmologist for the past 2 years or so. So we handle all these cases from here now. Then when patients come, they undergo procedures. The first time we have to determine whether you're blind or not. So we have this chart. We put it 6 meters away from you. Then we tell you to read through or to point where this E is facing. Up to the smallest. If you can see up to the tiniest, then your eye is normal. But if you cannot see even this one, if you see this one, if you put this at 6 meters and you only remain here and don't read this, it means what a normal eye sees at 6 meters, you only see when it's brought to me when a normal eye sees at 6 meters away,
Yes.
you only see this thing when it's brought to you at 6 meters. Then we know you have a problem. Some people, even at 6 meters, it doesn't work out for them. They cannot see this. So we have to move to 3 meters. They still don't see. They say, you mean I'm this?
Yeah.
Then we move to 1 meter. They still cannot see.
Yeah.
Then we even pass the hand
Okay.
over the eyes. That's when they know, this is serious. Some people cannot even see.
Okay.
A hand movement. Till we flash a light into the eye. They say, oh, I can see light. This is how serious it is. And many people who come to us here come when they cannot even count fingers. Or when we move this thing at 1 meter, they cannot see. The woman I worked on this morning was totally blind. She could not even see the hand being waved on her eyes. And she has been there at home. I don't know why people sit on these people. Even if we organize free eye surgeries, these people don't come. Actually, as Lions, I'm a member of Lions Club of Uganda, and I'm in charge of vision or eyesight for all the lions in Uganda. And we have a project for West Nile, for eye care.
Yes.
Where we shall be moving to Nebi, to Bakwash, to Yumbe, maybe Koboko, or even Ajubani, to screen people for blindness and treat them at a subsidized cost. Because eye care is very expensive.
Yeah.
We cannot give free surgery, we cannot give free eye services, but we subsidize it. Like now we are doing services in this clinic, Pibero, at less cost, 1/3. Our highest surgery is say 500, but with this project, patients may pay 200 or 300. But if you go to Mengo, Kampala, you pay 2 million or 1.5. So it is subsidized. So when you do, we check into your eyes like this. This is a microscope, very expensive. This is 12 million. This one. This one I can see what is in your eye, and I can see whether you have a wound, whether your iris is getting damaged, or you have a cataract in your eye.
Yes.
Very expensive, and it's redundant.
Okay.
When this one is not there, we can use this. This is a magnifying glass, a loupe. You can also use this. Use to see something has fallen in your eye, we use it for removing, or even this one. But people are gambling at home. This small instrument here can help me look inside the eye. We are the only doctors who see blood vessels inside the eye, inside the body, without opening the body, using this. I can see the nerves inside your eye. I can see the blood vessels inside your eye. I can see that you have diabetes by just looking into the eye with this. I see that the diabetes has destroyed the nerves inside your eye without causing you pain. And we have this. Look at it. This one, I can use it for determining whether you are short-sighted or long-sighted. Okay. Then I prescribe for you the glasses, which we make for you. Reading glasses are very cheap here actually. People should not be eating beans with the stones inside, because they cannot sort that this is beans or this is rice or gravels and so on. It's not only for reading. So we have the diagnostic kits, we have everything. They're expensive. Like this one is 2 million. This is another 2 million. This is a 12 million. And they are lying redundant because people are sitting at home.
They don't want to come.
They don't want to come and benefit from this. Arua Hospital has diagnostics. At least even if there is no eye specialist, the ophthalmologist or the eye doctor, there are other eye specialists, the clinical ophthalmic clinic officers. They do and see. If they cannot manage, they call me, they refer. If they can't refer, they can even refer to Mengo, can refer to Mulago. There's a child who came from Koboko last week. Came here, we looked in the eye. I called my colleague in Mulago that this child, we have done this, needs, there's also an eye specialist who specializes in children. Her work is just to see children. And we're in the same class. I called her, said, Chris, we have a patient. Said, send them. And I sent them. Yesterday she sent for me the feedback that I've seen this child. Now I got a problem. You know, this child was born prematurely. So she was put on oxygen. Oxygen causes blindness also. So the oxygen they used for treating that child when she was very young, a premature baby, caused some problem. Now she has referred her, this girl, to another doctor who specializes only in the retina.
Yeah.
You see how we can help you? There was a ophthalmic clinical officer in Koboko who saw the child, referred to me. I saw the child, I referred to my colleague who specializes in children. She saw the child and has now referred to another super specialized eye specialist. See how we can help you?
Yeah.
But if you sit at home and drink herbs, put urine in the eyes, you only help us to help you remove the eyes.
Yeah.
Yes.
Okay. Then also, doctor, maybe I heard you when you're about like how do you know someone is getting blind or not? You said that there is that part where you check with light, maybe with the hands. If so, it means then I can't see like the hands passing in before I'm blind.
Even you at home, sit at home, cover one eye with the palm, like this, and try to see the most distant object, if you can see. Many people, when they accidentally cover their, or something falls in their eye which is seeing, that's when they realize that, oh, this eye is not seeing. And it will have been over a long time without them knowing. So routinely every 2-3 months, cover one eye, try to look around, then cover the other one. If you don't see, run, come to us.
Yeah.
Yes, that one you can do self-assessment. Then too, some diseases like glaucoma, the one which raises pressure inside the eye, it starts destroying the vision from the side. So cover your eye and see if you can see that wall without looking at it.
Yeah.
Or I cover my eye, I'm looking at you, but I can see your colleague. If I cannot see him, it means this side of vision is getting lost.
Yes.
So do that and see. If you can see your sides. These are simple tests you can do. When you come, we also test and do that.
Okay.
Because there are some people who are blind out there, but they don't know that one eye is blind. Because the eye is compensating for the other one, and you don't know.
Yeah. Yes. Yeah, one eye may be seeing clear yet,
yes,
like compensating while the other has
yes.
a problem.
Many people come here for road driving test. They are sent by the police. Go for eye checkup. When we check, we find these people cannot see. And these people are going to our roads to drive.
Yeah.
Then they knock you, the borders. Many of them are not seeing well. They cannot read up to here.
Yeah. So
this is dangerous. If you cannot read up to here, it means what a normal eye sees at 12 meters, you can only see when it is 6 meters to you. Or if you read and stop here, it means what a normal eye can detect from 80 meters away. For you, you cannot see. You only see it when it's 6 meters away. Supposing you are a driver.
So and someone comes.
And someone is coming, you're also driving. You only see this thing at 6 meters.
Yeah.
It's very dangerous. So have your eyes checked. If the police are saying, go and check your eyes, don't make a trick and go to someone to fill these forms. Or you get a form which I had filled before and then you copy and put. That's being dangerous. To yourself and to the public on the road.
Yes.
Yes.
Okay, doctor.
Yes.
So now maybe briefly, I heard you talk about you will know someone is short-sighted or long-sighted and you give them these spectacles. How do you know that maybe this person is long-sighted or short-sighted?
Is this? I measure.
Yes.
When you're long-sighted, I do this. I determine. I say, oh, this one has normal vision, or is not long-sighted, is not short-sighted. This one needs, this is long-sighted, so needs this kind of spectacles. It's this one, this instrument. So we do that. And we have the trial frames which are over there, which we put and we check we put this, is this okay? This lens okay? This okay? When the patient says, okay, this one is okay, after I've determined that maybe you need +2, then I bring a lens which is +2, and then you test it. So it's okay, it's fine. Then we make for you the spectacles.
So these spectacles, like all about it's like they help me see clear, like they focus.
Yes.
The light.
Yeah, because now the natural lens is not focusing. We are now focusing. Like your friend has been focusing. He's turning. Huh?
Yeah.
He's turning. He's actually adjusting the power of the lens of the camera.
Yes.
Huh? So when I'm doing this, I'm also turning. I'm trying to focus which power is good for you. Then when I put it, you see clearly. And when it focuses, you see clearly. That is one we shall give you the exact one. Don't go and buy. People go to the taxi park
And they just buy without any guidance.
Oh, you see, oh, my father, oh, my wife is using this glass. Let me also use it for reading my Bible. No, don't share spectacles. Go to the eye center. They measure. We use these machines. We use the trial frames. Then we get the exact spectacles. Spectacles can be dangerous if you put on a wrong power.
Yeah. They can worsen the situation.
Yes. There was someone who came here. I saw him because for him he believed that he needs spectacles. I gave him, I said, your problem is not spectacles. You have dry eyes. Your eyes are not producing enough tears. You need only artificial tears. I gave him the drugs. When he got out, I think he threw out the drugs.
Yeah.
Went to another
eye
clinic or eye doctor. Then the eye doctor gave him a spectacle. Very high power, -2. Meaning we should be given for someone who is very short-sighted. So this man he was given the spectacles, he put it on. Now he's a businessman, he was going to Kampala. Then the man borrowed from Pakwashan to come back. Because the eye was paining so much. The glasses. You can put this. Put this and try. Put this and try to look at him. Can you see him?
I can't say.
You can't see him. If you try to walk, you will fall.
Yeah.
That's what the man had. In Pakwash, the eye was paining so much, he came back here. That you see, when I came here, doctor saw me and gave me some eye drops, but I went to another doctor and the doctor gave me spectacles. And my eyes are paining. The nurse who was here got the spectacles and removed them, and the headache stopped. He has never come here to complain that his eyes were paining.
Yeah.
He went back, picked the artificial tears I gave him, and is now okay.
Yeah. So meaning all these eye problems is not all about putting on spectacles.
No. Spectacles, no, we don't want to give spectacles. Personally, I didn't wear spectacles. Not even these ones where young boys. I didn't wear glasses. Not even these ones where young boys and girls put on so that they are seen. You know, people put on glasses so that they are seen.
Yes.
Not for seeing. I didn't even put that. I didn't use that.
Yeah.
Till I reached 40. When I was 40, I was even struggling to read. But when I reached 47, 48, my eyes could not now sustain. I had to put on glasses. So I use my glasses for seeing, not for being seen.
Yeah.
Many people, they also say, but now doctor, this one makes me look very funny. You get different frame like this. Yeah, we give you the frame.
Yes.
And the cost of the glasses are in the frame. If you want the designer frame, we shall give you. For both seeing and being seen.
Yeah.
Yes. But so good, because if I also give the person the frame he or she does not desire, he will not use it. I will not have helped him. So if he can afford, if he desires the frame, I afford, but I give the right power.
Yes.
Yes. So no, all diseases are about glasses. And there's a misconception that in some people that, when you are given glasses, it spoils your eyes. Yes, glasses spoil eyes if you wear wrong powers. But if you wear the correct powers, they are the best treatment for long-sighted and short-sightedness. But if you do presbyopia, all this aging, due to aging. But if you don't have these three conditions, we don't give you glasses.
Okay.
Yes.
All right. Thank you very much, Doctor. And also thank you to our viewers who are still watching this Daktari show here on West Nile TV. Hope you are getting to note of the emphasis Doctor is telling us. Note that when you have difficulties in your vision or you can't see very well, that you run to a nearby clinic, you buy these glasses or spectacles. It's not advisable. You may actually worsen the situation. However, it's advisable you go to these eye clinic specialists, these ophthalmologists. They test you such that they give you glasses which are appropriate to your eye challenge or problem. So maybe, doctor, which complications can arise to an individual who gets an eye challenge or a problem and they remain ignorant to come and see you for, or see an eye specialist for management?
One, when you delay at home, and many of the delays are, let me try this, let me try this, let me try this.
Yes.
And you note that my clinic here, people who come here are only people who have tried everything elsewhere and have failed. These are the ones who come here.
Yeah.
Huh? When people are still trying, they are there. They only come when they have got complications or when they have failed there. When you delay, the cataract continues becoming thicker and thicker and thicker.
It keeps on growing.
Yes, it keeps on growing and becomes heavier and heavier. And you know they are held by very tiny fibers. The ligaments are tiny. When they become heavy, they can dislocate and fall into the eye.
Yeah.
The operation becomes very difficult. And the outcome is difficult. But once they are just cloudy and you come, or when you come for checkup and we see, when they are still light, it's easier to remove. And we put this lens inside the eye.
Yeah.
It's an artificial lens.
So
it's like a spectacle. But we put it inside the eye. You don't need to wear spectacles.
It means you can cut open the eye.
Yes, we cut here, up here. Then remove the cataract and replace it with this artificial lens inside the eye. You will not know. You live with it for life, but you are seeing very well. Nobody outside will know that you are wearing spectacles inside your eye.
If you are outside there, you could be wondering. Also, actually, I wondered how you can't open the eye. And some thought it could shrink, and
it doesn't. So when you come early, we help you.
Okay.
Glaucoma, the pressure, we can prevent blindness when we create a hole through which that fluid inside, the water inside your eye, flows out into blood without getting clogged inside the eye. If you have a foreign body in the eye and you come immediately, you prevent the complication.
Yeah.
We remove it, you go back to work. If you stay with it, it will remain there. You pour all the drugs in your eyes, it will remain there till we remove it.
Yes.
If you have red eyes, if you have conjunctivitis by infection by bacteria, come and we give the appropriate drug. You have seen?
Yeah.
Here alone there are 4 different eye drops. Only here. Yeah? They do different things.
Yes.
This is a different thing. This one, a different thing. This one, a different thing.
Yes.
And it needs someone who knows to know which one to give you.
Yeah.
If I give you this one, the complication will be
You said that I can't see for
3 weeks. Only one drop.
Yeah.
And there's no treatment for making you see. Till naturally it becomes weak and weak and the effect goes away. Okay? So when you delay or you go to a wrong person, you get wrong treatment. Then we also have this now to our colleagues. We sit on patients. Some of the delays are us, the practitioners. You know you cannot manage this. And you sit on the patient because you want money. You got the story of that small girl from Koboko whom I referred. I could have sat on them, got all their money. But what would I have done? Would I have served them? Would I have served the community?
You wouldn't.
No. Some of our colleagues are the ones who are making people to believe that all diseases can be cured by spectacles. We know there's money in spectacles.
Yeah.
This one is 600,000. What if I give you? You can afford, right?
Yeah.
Then I give you even spectacles which will not cause you pain,
Just to get
to get money from you. That's what many of our colleagues are doing. It's unprofessional, it's unethical. That's what, and you're delaying treatment. If you know you cannot manage, refer. Yeah? I'm very happy with what my colleagues, my junior colleagues are doing in Nebi, in Koboko, in Germany. They're referring patients who go to them, to me.
Yeah.
So in Germany, you will go and get an eye care worker there. In Moyo, you get. In Yumbe, you will get. In Koboko, you will get. In Nebi, you will get.
Okay.
We have a project. We are training one for Nebi, not for Nebi, for Zombo because they don't have, and one for Bakwach from June, from August. It's a training for 1 year, eye specialist. So that when you're in Bakwach, you go to them. When you're in Zombo, you go to her or him. Then they will refer to me. If I cannot manage, I refer to someone. I'm actually receiving patients. Some patients go straight to Mengo. I'm receiving patients from Mengo. Say, go to Arua or go to Gulu, you will get Dr. Amos.
Yeah.
And you're handled from there. You don't need to run everywhere. So, if you delay at home and you have some diseases should be treated, ulcer should be treated within 12 or 14 hours, 48 hours. And if it takes 1 week, the drugs will not help you.
Okay.
So delaying at home is bad. Yes.
Correct. Thank you very much, Doctor. Maybe in a brief way, can you give us the preventive measures as we're almost coming to the climax of the show? How can we prevent blindness in the communities?
Prevention depends on the cause. One, good health-seeking behavior.
Yeah.
If you are pregnant, or if your wife is pregnant, let the wife go for antenatal. First 2 months she will go, then let her be followed up, so that they monitor the baby. They also monitor the health of your health as the mother. If you have anything which needs treatment, is treated, so that you don't pass the disease to your child at childbirth.
Yeah.
So that the child is not born blind. You deliver from the health unit. Immunize your child. When you immunize your child, the child will not get measles. They give you supplements of vitamin A. Right? And that one will solve the problem of corneal ulcers or corneal scarring in children.
Yes.
Dangerous games by children. Let's control our children. Let's not expose them to that. Routine eye checkup. Routine medical checkup. Check for blood sugar every year.
Okay. How about the eye checkup? How often do you recommend it?
Every year. If it's normal, if you have no complaint, just come and we do this. Whether you can see or not. Every year. At times we even organize and do it free of charge. You don't pay consultations. People don't come. That, for me, I'm okay. But why do you come when now you're blind? Come when you are okay. Actually, we want you to come when you are okay.
Such that we prevent.
We prevent it. Maintain hand hygiene. Good ventilation at home. Prevent these chemicals. Bleaching. People putting chemicals up to the eyelashes. Then the eyes start itching, they turn red, they put jams into the eyes.
Okay.
Yes.
All right. Thank you very much, Doctor. And also to our viewers, indeed it has been an exciting episode. Thank you very much, Doctor, also for giving in your time. You know you are always busy, so we don't take it for granted to come and educate the viewers of West Nile TV. Maybe you can give in your conclusion remarks to the viewers who have been viewing your exciting episode.
Yeah, thank you, viewers. Your health is our pleasure, and we are here so that you have your good eye health. You can promote your eye health, you can prevent blindness, we can treat your blindness. I've told you 80% of blind people can be treated and they see again. 80% of blinding conditions can be reversed or can be prevented. So let's work together. You, when you come, we are there for you and we identify your problem and solve your problem. I also thank West Nile TV for helping our communities to get this information. As I've said, we are waiting the funds we have got for this eye care project for West Nile. We are still finalizing a few things with the bank so that we access the money and we start moving to the communities and seeing patients who can pay, who cannot pay, cannot even afford, we just treat them. Okay. Subsidized cost, and we shall be all over West Nile. Okay. Yes.
All right. Thank you very much, Doctor. And also thank you very much to our viewers who are with us from 10 up to 11. We are indeed forever grateful, and I've been your host, Sunday Junior Tom. I'm wishing you all the best of your day till we catch up again next Thursday from 10 a.m. to 11 a.m.